Music is a story we've come to remember and will carry on for generations to come. For years, music's been used therapeutically, where it's underneath the tune where healing begins.
Music therapy is a professional healthcare practice where an accredited music therapist who has a minimum of a bachelor's degree in music therapy plus 1,000 hours of clinical internship works with their patients or their clients working towards non-musical goals but using music interventions. What we're doing is we work together to build goals that are non-musical, but we use musical skills to achieve those goals, and that can fall under the domains of emotional, cognitive, physical, and spiritual, just to name a few.
Squat, squat, stand.
Gemma runs the music therapy program at Vancouver General Hospital in the Burns Plastic and Trauma Unit. Using rhythm, song, and dance, music becomes a form of pain management, which can help speed up the healing process.
In the hospital setting, it's a high turnover rate, so I can have someone from 1 day to 3 months. So it's really working with that client and finding out what their goals are, and then I'll assess what they need, put together the plan, and then often what it looks like is me sitting bedside with them with my guitar and my box of small percussive instruments, and beginning from that point and using big set of tools of music therapy interventions that's going to work for their recovery.
It takes 5 parts of the brain to properly process music. Like any muscle, constant exercise can strengthen its operation, even the ability to learn to speak again after serious brain injuries.
I'm looking at can the person communicate? Can they receive information? So if you say something and they don't understand you, then there's a way to try and work on that with music. And then can they express themselves? So if that's that you can't speak, then I'm going to work on music. So if I say, happy birthday to, you just want to say you. So I use that momentum to try and help them with their speech. And I've learned some little tricks from the speech and language pathologist. So for instance, when I'm going like this is to actually stimulate an H sound. And then I'm modeling the L sound, so the L with where the tongue goes, because that can be really hard for some people to actually coordinate the movements in their mouth to actually make a sound. When you think about eating and speaking, the tongue is actually a muscle, and when you are injured, things can get mixed up. You can't coordinate things. So it's really hard, and the music, it's coming from a different part of the brain. It actually makes it a little bit easier. So the idea is to use that and then have that kind of transfer into more functional speech.
Music programs in geriatric facilities have seen massive success in helping residents to be more social, regain muscle coordination, and to just stay active.
In an institution, you're often isolated from your family, so you don't get a whole lot of social contact with your loved ones. So music therapy helps with that. It also helps with providing a really positive outlet for your feelings. It also gives you the opportunity to get some exercise. You move to the music, you move rhythmically, you're following directions, you're doing sequencing, auditory sequencing and movement sequencing. So that all helps to just keep your brain healthy.
Even though therapists are using music for cognitive growth, most times it can be so fun, you forget it's therapy.
In this lesson center environment, on the outside it looks very much like the student is coming for a music lesson with the teacher. However, I think because we're working in a therapeutic capacity, there's a certain form of flexibility that comes with that.
1, 2, 3, 4.
Good job! Okay, let's count while we play, okay?
So the client and therapist are engaging in a very relaxed manner. There's a clear understanding of boundaries, and there's also real openness. I think people around here really enjoy coming for their lesson because they do feel a real sense of competence, being able to participate in something like a recital or to share a song with their family members, maybe that they've written in session.
Hello, hello, hello. Everybody says hello.
And there's something about working with kids, seeing them grow both in musical and non-musical capacities at the same time is so encouraging, that they're learning to play an instrument and they're also growing as a person. There's something that is just really, really inspiring about that.
Yay! Good job, you guys.